is August 13th, and we're going to talk about your children's health with Dr. Felipe Zanghellini. He'll be our guest in studio today, and he'll take your phone calls. He's a pediatrician with Lovelace. He's been practicing medicine since 1991. So we're going to talk about what parents need to know to prepare your kids for the new school year, including back-to-school physicals, immunizations. APS, remember, started cracking down again last year to make sure kids had the updated required immunizations, updated shot records, or at least a waiver on file. So if you have any questions about immunizations, always a very passionate debate for many people, or just questions in general about your child's health, Dr. Z will take your phone calls at 243-3333. We'll also talk about the importance of sleep, obviously, now that the kids are heading back to school, diet and nutrition. And if your son or daughter plays sports, obviously sports-related injuries can be an issue for you and your family as well, especially when it comes to concussions. But any questions you have whatsoever, Dr. Z will take your phone calls this morning, or if you have an email question, you can do that as well. And Dr. Zanghellini, thank you very much for being with us today. How you doing?
Thank you, Bob, for inviting me. I'm doing really well.
Absolutely. Now, all week long, as I was promoting your appearance, I'd say your full name first, and then just follow up with Dr. Z, hoping that was your nickname. Is that what they call you around the hospital?
Yes.
Okay, very good.
That's the way all my patients, especially the little ones, call me.
Well, good. Then I wasn't out of step with calling you Dr. Z. That's good to know. So we'll continue with that this hour as well. Before we get into the issues of children's health and back to school and immunizations, let's talk a little bit about your background. You're originally from Chile, right?
Yes.
Okay.
I did medical school in the University of Chile. I got my medical degree in 1991, and then I did 1 year of general pediatrics in Santiago, Chile. And then I did 3 years of general pediatrics in Birmingham, Alabama. Then a 3-year fellowship in pediatric infectious disease. After that, I moved to New Mexico. I was practicing general pediatrics for 4 years in Roswell. And after that, I decided to move to Albuquerque.
Yeah. When you were in Chile and getting your degree and starting your career there, what ultimately led you to come to the United States when you first got to Alabama?
Well, I wanted to try. I wanted to always have the experience of living in a different country. And my initial idea was to do the residency for 3 years and go back home, but things didn't work that way. I decided to do the fellowship in pediatric infectious disease, and then after that, I ended up staying here in the country because I really like the United States.
Yeah, and as you mentioned, when you first came to New Mexico, you actually were down in Roswell. How did you end up there?
Well, in order to adjust my immigration status, I needed to work in what's considered an underserved area. And Roswell applied for that, so I worked there for 4 years.
And how long have you been at Lovelace now here in Albuquerque?
Almost 2 years.
Yeah.
I joined Lovelace in December 2013.
And you actually are based on the west side, at the hospital on the west side, right?
Yes, actually the clinic.
The clinic on the west side.
I do outpatient only at the clinic, the Lovelace Medical Group clinic on the west side.
Dr. Z, what as you were going through medical school and learning your craft, what ultimately led you to wanting to be a pediatrician?
To be honest, Bob, at the beginning I was not going to be a pediatrician.
Yeah, what
I
were you
was going to be an internist.
Okay.
But when I did my internship, we call internship the last 2 years of medical school, I realized that I was not convinced to work in my whole life with adults or elder patients. So it was a little bit of a crisis, and then 4 months later I did my internship in pediatrics, and I realized that I really like to work with children. You know, most of the time they get well, you know, and I enjoy being around children. Pediatricians in general also, they were very positive, optimistic. The doctors, I mean. So I like to work with that group too.
Yeah. Do you have? Are you a general medicine practitioner as a pediatrician,
yes.
or do you like or do you have also some specialties that you work on as well within that category?
I did a pediatric infectious disease subspecialty, but right now I practice full time as a general pediatrician.
Okay.
Of course, that helps me because you see a lot of infectious disease in your daily practice as a general pediatrician.
Yeah. Now, just a couple of questions in general when it comes to parents and their kids. How often should parents take their children to the pediatrician for a general physical, a general checkup?
Well, we have a schedule of visits from the time that they are born. Is really more frequent. We usually see them at birth. We tell the parents to make the appointment as soon as possible after they are discharged with their brand new born, and we see them to make sure that they are not losing too much weight, that if they get jaundice, the level doesn't get too high, that the breastfeeding is going well, and all that, and make sure that his or her general health is good. After that, we see them at 2 weeks, 1 month, 2 months, 4 months, 6 months, and then we come 9 months, 12 months, 15, 18 months, and then 2 years, and then once a year after that. And we usually stop around, we stop at age 18.
Oh, okay.
But
that's the general cutoff age, like if for someone to be seeing a pediatrician. It can be all the way up to 18?
Well, actually, sometimes we see them until they're 19.
Oh, okay.
To give them some time to do the transition to a family practice or an internist doctor. And to be honest, it's hard. It's hard when you have been taking care of a child to let them go.
Yeah.
You build a relationship with them, you build a relationship with the family, and and it's kind of hard.
I was going to ask you that. I mean, what's it like to be someone's doctor from the moment they're born up until they are in their late teens?
Yeah, I think that is very exciting.
Yeah,
I always get excited when I see a brand new newborn. I think that every newborn is a miracle. I mean, all the things that need to happen to have a normal, healthy newborn is amazing, And then they start smiling to you, and then they start talking to you in their own language, and then they start walking and running and calling you Dr. C, what I mean? And then it's a very exciting process, and of course, I mean, they get sick too, and
sure.
It's very rewarding when you can help them to get better, and when you can advise them, like you say, not only the patient, the family, to issues like diet, nutrition, exercise, sleep, safety guidelines, and to guide a little bit their growth process.
And we'll talk a lot about those medical issues for families and their kids. Now, as you just described it, and you can just see the enthusiasm that you have in terms of the relationships that you build with the child and the families, that also must make it extremely difficult and emotional for you as well when one of your patients comes down with a serious illness.
Oh, yeah, I do. I mean, every patient is really special for the pediatrician, and we always worry about that, and sometimes, unfortunately, we have to face also with the fact that some patients die, and that is very hard, always very hard.
All right, we'll take a break here, and we'll come back, and we'll include your phone calls at 243-3333. Dr. Felipe Zanghellini is in studio with us. 2 weeks until back to school, so we're talking about your children's health. We'll touch on immunizations, but any questions that you have for Dr. Z, give us a call now at 243-3333. We'll also discuss sleep and diet and nutrition, and if your son and daughter play sports, of course, sports-related injuries as well. We can talk prenatal care, anything that you want to discuss with Dr. Z. Now's your chance to call in and give us your question at 243-3333. You can also email me, Bob at 770kkob.com.
Bob.
Dr. Felipe Zanghellini from Lovelace, a pediatrician practicing medicine since 1991, is our guest in studio. Back to school 2 weeks from today for kids here in Albuquerque. So we're talking about your child's health. If you have any questions about immunizations or any other health issues for your children, give us a call now. And you can ask Dr. Z any questions you've got at 243-3333. You can also send me an email, bob@770kkob.com. And Dr. Z, obviously one of the big medical issues for kids as they get ready to go back to school, immunizations. And before we get specifically into that, they are required by state law, but there are two types of exemptions for your children. One is for medical reasons, one for religious reasons. If there is a medical reason for your child to get an exemption, you need a signed, this is by state law, you need a signed medical exemption from a duly licensed physician attesting that it would endanger the life of your child by having these immunizations. If there is a religious reason, the child's parent or guardian must ask an officer of the church to write a letter on their behalf stating that you are a member of a church and the church uses prayer and spiritual means alone for healing. If access to a church officer is not possible, then the child's parent and guardian must complete the certificate of exemption form. But that is it. Those are the two exceptions, medical and religious. And Dr. Z, it's really an amazing debate that happens when it comes to children and immunizations. It's a passionate debate. I think most parents obviously don't have a problem having their child immunized throughout their life as required by law to go to school. But there are a lot of parents who don't believe in it, and they are very passionate about their position. What are your thoughts on immunizations?
Well, most of the parents, I will say, they don't have any problems immunizing their children. Actually, they like to do that.
Yeah.
And in our practice, we have got over the last, I will say, 3 years, a greater than 90% immunization rate in our patients. And I think I am a very big advocate of immunizations, and I think that they make a big difference for your child's health. I have treated almost all the diseases that the vaccines prevent, and I can tell you that they are very serious or they can be lethal. And I'm not exaggerating with this. So I think that a very important part of any child care is that they get their vaccines on a timely basis. I know that there are some groups that they advocate not to vaccinate their children, but I think that they are putting those children at risk for what I said before, very serious or potentially lethal diseases.
Is there any debate within the medical community among other colleagues of yours, other pediatricians, in terms of immunizations? Or has every doctor that you've ever worked with always been on board with them as well?
Well, with the group that I practice, we don't have that much debate. I have a debate with other pediatricians, yes. But I will say that most of the colleagues that I have worked with or talked with we are in agreement that immunizations are a mainstay of children's care.
What are some of the typical concerns that come up for people who have questions about them and aren't convinced that immunizations do more good than harm?
Well, one of the main ones is the link between a particular vaccine, measles, mumps, and rubella with autism. Actually, there is no proof that link exists. There was a paper published more than 10 years ago now with Dr. Wakefield, and it was a very poorly done paper who hypothesized a link between MMR and autism. Actually, that has been proved that it doesn't exist. The other concern that people have too, also, that we are overwhelming the immune system by giving too many vaccines, and that is not true. I mean, children are exposed to antigens, are exposed to germs, are exposed to bacteria, to viruses on a daily basis, and the immune system can deal with them without any problem. Mm-hmm. And it's the same with vaccines.
Yeah. Now, we've heard from some parents when we've talked about this issue last year when APS was cracking down on immunizations, and there was actually some talk in Santa Fe about even narrowing the exemption law more so than we have it now, who have no problem with their children getting the immunizations, but sometimes they might have a concern they're getting too many shots at once. But there is a fairly standard schedule that's laid out for children from birth on, right?
I mean, the schedule that is laid out, it has a lot of research behind it. You know, we do these vaccines on this time based on the antibodies that they get from the mother if they're breastfeeding, you know, the antibodies that they get from the mother before they are born. So there is a reason why we do the MMR, for example, and the varicella at 1 year of age. Before that, the antibodies that they get before birth could interfere with the immune response that they mount after they receive the vaccine.
But as a pediatrician, you're the state law aside, because they are required for kids in terms of going to school. But your recommendation as a doctor is parents really should not be concerned about this and should get these immunizations as they are scheduled for their children's overall health.
Yes, without any doubt. I think that immunizations have proved over and over that they're extremely safe, and they really protect you against the diseases that they say that they're supposed to protect. I mean, we haven't seen polio in the Americas since 1991. So that is, for me, is a major achievement. I mean, 60 years ago it was endemic. Every summer it was a matter of luck if your child would get polio or not.
All right, we'll take a break here for the... I'm sorry.
For example, the Haemophilus influenza meningitis, since the vaccine came out, I have never seen a case. And before that, I saw more than 10 cases that were not. Some of them were very devastating for a child.
All right, Dr. Z's here to take your calls, 243-3333. Right now, the news. Rich for a minute is back to school. First day of classes here in Albuquerque at APS, Thursday, August 13th. So we're talking about your child's health. If you have any questions whatsoever, Dr. Felipe Zanghellini from Lovelace is in studio with us. Dr. Z, he'll take your calls at 243-3333. Toll free is 1-800-460-0770. And if you want to send me an email, you can do that. My email address is bob@770kkob.com. We just spent last segment talking about immunizations. So if you have any questions about that, Dr. Z can answer your phone calls. And we're also going to talk about sleep and diet and nutrition, exercise, obesity, and we'll also talk about back-to-school physicals as it relates to it. That's often a requirement for kids who play sports at the middle school and high school level, so we can talk about any sports-related injuries that are always a concern, especially when it comes to concussions. But so give us a call now. You can also email me, bob@770kkob.com. Well, Dr. Z, let's talk now about probably one of the biggest battles parents face. It's probably one of the two biggest battles they face when the kids are back in school. One is get your homework done, and then second is get to bed, sleep. Obviously, it depends on the age of the child, but let's talk a little bit about the amount of sleep you believe is necessary for a child to be well rested so they are performing at their highest level in school.
Well, sleep, Bob, is very important. And one thing that helps at any age is to go to sleep at the same time every day. Children like routine. Mm-hmm. And in that, parents should be very disciplined and enforce a bedtime every day at the same time. Children get used to that, and they should get, I will say, between 8 to 10 at least hours of sleep every night.
I know a lot of parents listening right now are like, boy, dream on. I wish.
Yeah, dream on. I agree. But that's it should be.
And is that the standard number you give out regardless of the age, whether we're talking about an elementary school age child, middle school, or high school?
Yeah.
8 to 10, that's the goal.
Yes.
All right, 243 3333. But the key you're saying is to make sure it's part of the routine, because not only because then their bodies get used to going to bed at a certain time and they start to wind down a bit, right? And then maybe that just they're like, well, it's time for me to go to bed.
Well, if they are used to go to bed every day at the same time, the struggle at some point will stop. And that is important that parents follow that rule, no matter what. I mean, in weekends it can be a little bit flexible because they don't have to go to school the next day. But during the week, I will set up a certain time and I will stay with it the whole week.
Okay. All right. Let's talk about diet and nutrition, especially when the kids are heading back to school. People, parents are working. The kids are getting ready to go to school. They got to catch the bus or they got to get in the car and head to school so they can be there on time at first bell. So sometimes breakfast isn't as good as it should be. Overall, diet and nutrition. Let's talk about that now a little bit and start with breakfast.
Well, breakfast is a extremely important meal of the day. I mean, you need to have a good breakfast.
That's not just a cliche, is it?
No. You have to. There are studies that have proved that actually people who get a good breakfast, they have decreased rates of obesity. They tend to snack less during the day, and they function better if they get a good breakfast. So I will tell them always try to get a good breakfast and ideally have the time to eat what you are having with breakfast slowly, not in a rush, because in that way you are going to digest it better, and it will make you more benefit.
What are some of the things that parents should be focusing on for their kids when it comes to breakfast before they head off to school?
Well, try to get what they like, in that way it will be easy for them to eat. I would probably recommend milk, eggs sometimes as source of protein. They can have a cereal too. They can have a toast. Fruit is another one that I would recommend too.
Yeah. And diet and nutrition, I know we're beginning this conversation as it relates to when kids are heading back to school and to make sure that they are performing well and have good energy when they get to school so they can do well in class. But overall, diet and nutrition is something, as a pediatrician over the last 23, 24 years, has become a big concern for pediatricians like yourself as well, right? I mean, in terms of what you're seeing and kids' weight. Many children are far overweight now than what they should be, right?
Yes. Diet and nutrition is another thing that we always focus as pediatricians because it's extremely, extremely important. You are what you absorb, Bob. So you are essentially what you eat. So it's very important to be informed about what is healthy, what is not healthy to eat. And we are seeing in the pediatric population a rise in the rates of overweight and obesity. That is becoming a little bit worrisome. I mean, we are seeing diabetes type 2 in the pediatric population, what before was an adult disease. So diet and nutrition is something that I always address, and I try to answer all the questions that my parents have during the well child visits, and specifically in the adolescent population during the annual checkup that I always recommend because, like I said before, it's extremely important.
What are some of the factors that you think are playing into more children being overweight and out of shape?
Well, I think that one is the kind of food that they eat. Processed food, fast food, tend to have a lot of calories. The size of the portions, I think that the size of the portions sometimes are too big. I mean, sometimes a portion can feed two people easily. The other thing that influences is I always recommend to exercise every day. Exercise is very good for you. At least 32 minutes to an hour every day if possible. And that is not happening. They prefer to be in front of the smartphones, in front of the computer, playing video games, or in front of the TV, and you are not expending any energy when you do that. And that, of course, influences the weight rate, So, like I said, it's very important to, one, exercise on a regular basis and focus on what you eat and how much you eat.
You know, a lot of the parents who are listening right now, as we were all growing up, that was one of the first things we would do when we got home from school is we'd run right back outside and play with our friends for a few hours before we got called home for dinner and then had to do homework. But that just doesn't happen that often anymore.
No.
Mainly because of all of the things that you've just talked about. So, I mean, parents somehow, some way have to figure out a way to break that cycle, right?
I would ensure that children's play. I mean, children's play is extremely important in the social, developmental, everything. You know, you build your experiences through play when you are growing up.
Yeah,
and you are spending time outside too. I mean, contact with nature is something that really should be encouraged with children. So they learn to appreciate nature and they learn to enjoy it. So they are going to transmit the same message to their future children.
Mm-hmm.
So by you teaching your children, you are also teaching your grandchildren because they are going to learn those habits from you.
As you were talking about diet and some of the things that children are eating, sugar is a big issue as well. And in some fairness, unless this is why parents need to read the labels because they think they're giving them like a fruit juice, but yet it's loaded with sugar, right?
I agree. Fruit juices have a lot of sugar.
And sodas and things like that.
Sodas is amazing. One can of Coke, regular Coke, has 12 teaspoons of sugar. So that's why. And children become a little bit addicted to that because they get used to that. Mm-hmm. So they need to keep that level of sugar. And that is not good because when you eat a lot of sugar, yes, you get like a energy, but then when it goes down, you get a dip in energy. I mean, many times when you eat too much carbohydrates, you feel better for the first hour, but then it comes a dip and you really feel tired.
Yeah.
So I think that you are completely right. I mean, people should focus on how much sugar, how much candy, how much soda their children are eating. I encourage them to drink water. I mean, water is extremely important for you. We are built, our bodies are built mainly of water. And it's important always to keep ourselves well hydrated and try to limit the amount of sugar that they eat.
And for children who are growing up and they are overweight now, if it's not something that's dealt with while they're still young, it just becomes a part of their life moving forward for the most part, right?
Yes.
It's hard to change after they become adults.
Yeah, I mean, if you don't correct it as a child, the fact that they are going to continue being overweight or obese as adults is going to happen and increases the risk of many diseases like heart disease, like diabetes, like high blood pressure, you know, and some types of cancer are related also to overweight and obesity. So that's why it's very important to focus on what you and your children are eating.
Okay, we'll come back one more segment with Dr. Z. We'll talk about, for those of you who have children involved in sports in school, we'll talk about back-to-school physicals and also sports-related injuries, especially for concussions, which are always a concern. That's next here on 770 KKOB.
Get weather alerts to your phone. Text weather to 6766.
Our final few moments here on the program with Dr. Felipe Zanghellini from Lovelace, Dr. Z, pediatrician, and we've been talking about back to school and your children's health here. And in the final few moments, I just want to let you know as well, Dr. Z is accepting new patients. You can get more information. Go to lovelace.com is the website, and you'll be able to get more information on Dr. Z and all of the other doctors there at Lovelace. And Dr. Z, let's deal with, obviously, back-to-school physicals are a part of the back-to-school routine for families who have children who play sports. And this time of the year, we're talking football and soccer and some other issues like that, and sports-related injuries, especially concussions. So for a parent who has a son who's playing football or a son or daughter playing soccer, or regardless of what the sport is, what are a couple of symptoms they should sort of be on the lookout for if their child comes home from practice one day or comes home after playing in a game? A couple of symptoms they should look for that could maybe mean there's a possible concussion situation.
Headache would be one. Nausea, vomiting. alter mental status. They are not acting like they usually do, or anything that it looks abnormal. Parents in general, they know their children.
Yep.
And if they have a doubt, what I will recommend is to get them evaluated, because sometimes it can be a problem that it's not only a concussion. Maybe they didn't hydrate themselves in an adequate way during the game, during the sports.
Another issue that's important.
It's very, very important, and children sometimes tend to postpone it until they're thirsty. I think that when they're playing a game, especially in the summer when it's really hot, and they can lose a lot of fluid in a 30-minute to 1 hour period, it's very important to keep yourself well hydrated.
Timing for that is good, too, because football training camp opens soon for high schoolers, and it's still hot this time of the year. And I know that's something sports teams and their coaches and physicians are much more aware of now maybe than they were 20 or 30 years ago, but parents still need to be on top of that, too.
Parents and coaches, too.
Yeah.
They need to allow the players to drink whatever they consider needed.
And the other thing you wanted to mention here before we wrap it up, and we're almost out of time, is for pregnant women, regardless of their economic situation, their income, prenatal care is crucial, and it's available to anyone.
Yes, and it's crucial, like you said. It's very important to make sure that the pregnancy goes well and they don't develop any complications.
Yeah.
And another thing that I want to touch, Bob, is the sports physicals are very important, but I think that every adolescent, that they are usually a very healthy population, they should get a physical every year. And at Lovelace, we try to do that. They can go to lovelace.com, like you said, or call the office at 505-727-6300.
Dr. Z, thanks for being here today. We appreciate it.
Thank you to you, Bob.
Something to think about right now, 770 KQB.